Of course, it's not just the nurses striking. We have a pending ambulance strike as well, which does rather beg the question, taken together, is there a risk to life if these strikes go ahead? Could people die as a result?
Well, good morning. We are putting all necessary derogations, working with the unions and individual trusts to make sure that there are minimum service levels, both at ambulance trust level and indeed at hospital trust level, to ensure patient safety. It's my number one priority. I know it's the number one priority of NHS staff. I hope it is also the number one priority of unions. Those conversations are ongoing with ambulance trusts and unions, and I know the Secretary of State and I have meetings with unions later today to firm that up.
Sure, but if they're not attending Category 2 calls, if they're not attending Category 2 calls, which is the implication in parts of the country, that minimum service level may not be sufficient. So I will ask the question again.
Well, let me be absolutely clear.
Life?
Let me be absolutely clear on that. Our expectation is that Category 1 and Category 2 calls are covered. They are considered to be life-threatening or emergency calls. And my call to the union, as I will repeat later today, is that Category 1 and Category 2 calls, which make up around 50% of all calls to the ambulance service, should be covered as part of derogations.
The complaint on the part of specifically the paramedics is that people are currently dying as a result of a service that is overstretched. I mean, Unite the Union, admittedly not your favourite people in the world, but through a Freedom of Information request, they discovered that the West Midlands Ambulance Trust has seen an absolutely staggering increase in patient deaths. Nothing to do with the trust. In 2020, according to official figures, 1 patient died. In this year till September, 37 people have died because of ambulance delays. I mean, the paramedics have a point, don't they?
So, look, at the moment, the service is below where we would hope and expect it to be. In part, that's pandemic-driven. It's largely not down to the ambulance trust itself, but issues actually with bed occupancy and discharge within hospitals. That's why we've put an extra £500 million into discharge this winter, opening up an extra 7,000 beds. But on these issues, my door and the door of the Secretary of State is open. We want to discuss these with the unions. I'm having further conversations with them later today. But these are not issues relating to pay, which is the main issue that is driving the conversations on behalf of the unions. Now, anything with regards to patient
with tens of thousands of places, of posts unoccupied, unfilled within the health service, I gently suggest that perhaps pay does have something to do with it.
Well, you specifically asked about paramedics. Paramedics, we have an extra 3,000 last year, another 3,000 being recruited this year. We have 40% more paramedics and ambulance staff compared to 2010. The issue is actually within hospital trusts, and we are putting the resource in to address that, to ensure that the handover times within hospitals come down, so ambulances can get back out on the road. That is not an issue specifically when it comes to ambulance trusts and pay.
But the critical incident declared by the Ambulance Trust in the North East, because because of the understaffing levels, that presumably it doesn't fall under what you were just describing there.
So the largest issue is around handover delays, and that is largely about bed occupancy levels within hospitals, flow within hospitals, and discharge into adult social care. They are all issues that we are tackling, but we're also building up resilience within the Ambulance Trust too. An extra £150 million, an extra £20 million. Invested in the fleet. And as I say, we are investing in more paramedics too. And my door and the door of the Secretary of State is open when it comes to discussing those issues around patient safety and working conditions for staff. What we are not willing to negotiate is reopening the pay for this year, which is part of the independent pay review body recommendations, which the government accepted in full.
You say that your door is open. You say that of Steve Buckley is open as well, particularly as regards the nurses. But is it potentially possible that Rishi Sunak closed that door and put his foot up against it when he stopped your boss from giving nurses a one-off payment that could have brought an end to these strikes?
No, I don't think that is the case. I mean, where you're right is that the NHS has a fixed budget. That was set at the autumn statement. We had an extra £3.3 billion a year, and we've got important issues to tackle, including the COVID backlog of around 7 million patients. And we're busy.
Did the Prime Minister or did the Prime Minister not block a one-off payment?
No, I haven't seen any specific detail around one-off payments. But what I would say is this: our door is open to discuss with the unions anything relating to working conditions. What we can't do, Niall, is go back into reopening the pay award, which was set by the recommendation by the independent pay review body, whose recommendations we accepted in full. Sure. They will now be looking to next year as independent pay review body recommendations to kick in from April. And let's not forget, we're 3/4 of the way through this year already, and any extra percent over the £1,400 or average 4.72% equates to £700 million.
Sure. We are also, midway through a kind of a period of extended strikes, and perhaps people might want to get things sorted out. I have to raise something though. Rishi Sunak this morning, given a rather interesting interview to the Mail, in which he kind of talks about Sunakism, his kind of political philosophy, and he says this, which I think will cause people to stop and stare. The first thing Mr. Sunak says that I want to deliver for people is peace of mind. Peace of mind is also about knowing that public services like the NHS are going to be there for you and your family when you need them. And he then goes on to talk about waiting lists. I mean, is Mr. Sunak taking the mickey?
No, not at all. And if you look at the most recent autumn statement, it was exactly that: public services that were prioritised, whether it was the extra £8 billion into health and social care or the additional funding into education. That's exactly
the NHS is going to be there for you and your family when you need them. They're not right now for many, many people because of this government's refusal to negotiate on pay.
Well, look, we have an independent pay review body recommendation, which we've accepted in full. It's important that you have that process. And let's not forget that last year we had the same process where the recommendation was 3% when the wider, for NHS staff, when the wider public sector was frozen. That was at the time three times higher than inflation. This year we've accepted those recommendations in full, but it's important to point out, because you reference nurses and paramedics, but actually what we're talking about is the entire Agenda for Change workforce, which is 1.24 million people who work within the NHS. They're on the same Agenda for Change contract. So any change, that's why it costs £700 million for every 1%. The ask of the RCN of some 19.2% equates to £10 billion. Now,
I will, however, note that at regular points over the past 12 years, this Conservative government has ignored or added to the recommendations of a variety of independent pay review bodies. I do, however, I'm sorry, I know you're pushed for time and I want to let you get away, but I just need to ask you, Sky News has been running an investigation this morning about the Hunter Combe Group, serious allegations of failures in care. We were first reported on this in October. Now, again, another 30 patients have come forward with legitimate complaints, it would appear. What is your department going to be doing about that?
Well, I've seen your report. It's totally unacceptable. And if I were a patient or a family member of a patient, I would rightly want answers to that too. I know, having spoken with my colleague, Minister Maria Caulfield, who has responsibility in this area, she takes it incredibly seriously. And I know both NHS England and the CQC will want to look at this very closely indeed.
Minister, it's great to have you on this programme this morning. Thanks for joining us.
Pleasure. Thank you.